Now coming to our second lecture, that is the beta-lactam antibiotics and the macrolide antibiotics. Now one by one we are going to see each category of antibiotics and what is their mechanism of action, what is their importance, what are the adverse effects, etc. So first category are the beta-lactam and the second one is the macrolide antibiotics. So in the beta-lactam antibiotics, we have four subcategories. The penicillins, they are classified under the beta-lactam antibiotics. The cephalosporins, carbapenems, and monobactams. So these are the four subcategories of the beta-lactam antibiotics. So in this we are going to see the two important categories, that is the penicillins and the cephalosporins. So penicillin, you might have heard many times, penicillin is extracted from molds. That is, it is extracted from a fungus, which is known as Penicillium notatum or Penicillium chrysogenum. So it is extracted. It is a natural. It is extracted from natural source. Now the problem over here is the bacteria. They develop certain enzymes, and these enzymes leads to inactivation of penicillin. Those enzymes are known as beta-lactamase enzymes, or you can say they are known as penicillinase enzyme. So this penicillinase is the enzyme which inactivates the penicillin. So penicillinase is an enzyme which is produced by the bacteria and which can inactivate penicillin. That means this bacteria is able to cause enzymatic inactivation of penicillin. The defense mechanism of this bacteria to develop resistance is enzymatic inactivation. So beta-lactamase are a family of enzymes which are produced by the bacteria, gram-positive or gram-negative bacteria. Within the beta-lactamase, we have this penicillinase enzyme. So these enzymes, the beta-lactamase, the category, the family of beta-lactamase enzymes, what is their function? Their function is to inactivate the beta-lactam antibiotics. So they can inactivate penicillin, cephalosporin, monobactams, carbapenems. Okay, these are beta-lactam antibiotics. But the enzyme that is produced by the bacteria, the beta-lactamase category of enzymes, these enzymes which are produced by the bacteria, they can inactivate these drugs. So that is why they are known as the beta-lactamase enzymes. Within the beta-lactamase, for penicillin, we have penicillinase enzyme. Who is producing this penicillinase enzyme? The bacteria is producing in order to inactivate the penicillin. So in the classification of the drugs also, we have penicillinase sensitive penicillin. That means these drugs are sensitive to the penicillinase enzyme. Penicillinase resistant penicillin. That means these drugs are resistant to penicillinase enzyme. Broad spectrum penicillin. That means they are broad spectrum, however they are sensitive to the penicillinase enzyme. The last category of drugs are beta-lactamase inhibitors. That means these drugs inhibit the beta-lactamase enzyme. So these drugs can be combined with the other category of medications in order to protect them from getting inactivated from the beta-lactamase enzyme. So that is why they are known as beta-lactamase inhibitors. Now first we will see what is the mechanism of the first category, penicillinase sensitive penicillin. So these drugs, they are inhibiting the bacterial growth. How are they inhibiting the bacterial growth? By acting on a mechanism which is known as transpeptidation reaction, which usually takes place in the cell wall, in the synthesis of cell wall. this transpeptidation reaction takes place. So the penicillinase sensitive penicillin, they interfere with this reaction which takes place in the bacterial cell wall. So they were used in dental infections before, but now they are not used because of their resistance. So before, when they were used for different conditions of the gum such as pericoronitis, ulcerative gingivitis, and apart from that they were also used for pulpitis, etc. But now their use is limited. However, they are used for different streptococcal infections, meningococcal, pneumococcal, gonococcal, so all the infections which are caused by the streptococcal bacteria. They are used for those conditions. Pharyngitis, bacterial endocarditis, otitis media, etc. Apart from that, penicillin is a drug of choice for the treatment of syphilis, and it is also used for the treatment of diphtheria, anthrax, tetanus, gas gangrene, etc. You know what is diphtheria, anthrax, etc., right? They are also bacterial infections. Diphtheria is also a bacterial infection which leads to the formation of, some covering in the throat, which leads to breathing difficulty, paralysis, or even death. Okay. So all these conditions are treated with the penicillinase sensitive penicillin. However, they have many side effects. So first of all, they develop hypersensitivity reactions. So most of the penicillins, they develop hypersensitivity reactions in many patients. So not most of the patients, some patients are hypersensitive to most of the penicillins. So they develop hypersensitivity reaction and they can develop anaphylactic shock also. So 5 to 10 patients who take penicillin, suddenly they develop allergic reactions, anaphylaxis, etc. So, you know what is anaphylaxis? It is characterized by rashes, many multiple conditions such as edema of the skin, asthma, difficulty in breathing, hemolytic anemia, granulocytopenia, that is drop in the number of granulocytes, skin rashes, etc. Other minor adverse effects include nausea, vomiting, inflammation, pain, etc. Next, coming to the broad spectrum and penicillins. Broad spectrum, they are broad spectrum, but they are sensitive to the penicillinase enzyme. That means they can be deactivated by the penicillinase enzyme. So these are well absorbed, or they do not get destroyed in the gastric acid, but they can be destroyed by the penicillinase enzyme, and these are more effective than the previous category of penicillins, the penicillinase sensitive penicillins, that is the benzyl penicillin, against a wide variety of gram-negative bacteria. Amoxicillin, you might have heard, it is a semi-synthetic penicillin. It works mostly like ampicillin and it is very frequently used against many dental infections. Now, what are the combinations of broad spectrum penicillin? How are they combined? How are they given with other medications to treat different type of conditions? The first is amoxicillin plus clavulanate potassium. The function of clavulanate potassium is to protect amoxicillin from the beta-lactamase enzyme. So it helps to extend the antibiotic effect of amoxicillin. So clavulanate potassium basically has a protective function. It protects amoxicillin against the beta-lactamase enzyme. If amoxicillin is combined with bromhexine or carbocysteine, it is used in the treatment of conditions of the respiratory tract such as bronchopneumonia, bronchitis, sinusitis, etc., otitis media, etc. Amoxicillin plus cloxacillin. Cloxacillin is also another antibiotic which is classified under the penicillinase resistant penicillin. So when these two are combined, they can be used in the treatment of lower respiratory tract infections. Apart from that, they can be used for UTI, gynecological infections, infections of the bone, that is osteomyelitis, endocarditis, meningitis, etc. Excuse me. Amoxicillin plus probnicid. Now this probnicid alone is used in the treatment of gout. So when it is combined with amoxicillin, it can be used in the treatment of skin infections, bacterial septicemia, and it can also be used in the treatment of respiratory tract infections. So these are the different combinations of amoxicillin with different drugs. Next, coming to the beta-lactamase inhibitors. As I told you, these are those drugs which will inhibit the beta-lactamase enzyme. So they can be combined with other drugs which cannot inhibit the beta-lactamase enzymes or which are sensitive to the beta-lactamase enzyme, such as it can be combined with ampicillin, amoxicillin, piperacillin, etc. You might have heard about the antibiotic that is augmentin, right? So augmentin is nothing but amoxicillin, but it is combined with clavulanic acid. Now what is clavulanic acid? Clavulanic acid is a beta-lactamase inhibitor. That is why amoxicillin is combined with clavulanic acid in order to protect amoxicillin from the harmful effect of beta-lactamase enzyme. Same example is ticarcillin, also the brand name is Timentin. Another beta-lactamase inhibitor is sulbactam. It is a semi-synthetic uh, drug and it is also combined with ampicillins, and it can be used against beta-lactamase producing bacteria such as Streptococcus aureus, H. influenzae, etc. Now clavulanic alone. Clavulanic is known as a progressive inhibitor, or it is also known as a suicide inhibitor, because it binds to the beta-lactamase enzyme and it inhibits the beta-lactamase enzyme. So initially it just binds to it, and later as the time passes, it inhibits the beta-lactamase enzyme completely. And it is known as suicide inhibitor because after binding to that enzyme, it gets inactivated. So the uses, most important use, as I told you, it is combined with amoxicillin, that is it becomes augmentin. It is sold in the name of augmentin and it is used for skin infections, gynecological infections, urinary infections, respiratory tract infections, etc. And in most of the what do you say, most of the cases in hospitals, this augmentin is prescribed to the patients. Adverse effects, it can cause stomatitis, vaginitis, and in some cases it can cause problems to the liver also. Next category we are going to see is the cephalosporins. Now we have four generation of drugs of cephalosporins: the first, the second, the third, and the fourth. So every time a new generation of medication comes, it will be better than the earlier generation. As I told you, first generation will be good, then the second generation will be developed. So second generation will have more effectiveness and less side effects when compared to the first generation. Similarly, is the same with the third generation and the fourth generation also. So cephalosporins as a whole, it is also obtained from a fungi which is known as Cephalosporium. And all the cephalosporins are bactericidal in nature. That means they kill the bacteria completely. And they act on the cell wall. Where is the mechanism of action? They basically act on the cell wall. Now, depending on the overall antibacterial activity and potency, they are divided into four generations. So as I told you, how is their activity and how potent they are, how effective they are divided into four generations: first, second, third, and fourth. So every time a new generation drug comes, it will be better than the earlier generations. So the first generations, they have a high activity against gram positive, but they have weak action against gram negative. And they are also resistant to the penicillinase enzyme, especially which is secreted by the staphylococcal bacteria. The second generation has good activity against gram negative. The first generation had weak activity against gram negative, but the second generation is developed, it has a good activity against gram negative, but their utility will decrease in favor of the third generation. So now we have the third generation. The third generation have the it has more activity against the gram negative bacteria, and they are also resistant to the beta-lactamase enzyme which is secreted from the gram negative bacteria. However, they have less activity against sorry. However, they have less activity against the gram positive bacteria. Now, among these third generation, the two important drugs, that is ceftriaxone and cefotaxime, they have become the agents of choice in the treatment of meningitis. In the fourth generation, we have one drug, that is cefepime, which is used parenterally. It has a broad spectrum of activity and it is active against both streptococci and staphylococci. Next, coming to the macrolide antibiotics. Now these macrolides are a complete different set of antibiotics. They are not classified under the beta-lactam. As I told you, beta-lactams are having four: penicillin, cephalosporins, carbapenems, and monobactams. Now the second category of drugs, that is macrolide antibiotics. Now these macrolide antibiotics are erythromycin, azithromycin, clarithromycin. So you might have heard, whenever respiratory tract infections are there, any of these drugs will be prescribed: erythro, azithro, and clarithro. So they are basically helpful in the treatment of respiratory tract infections. Now, what is their mechanism? They are acting on the ribosomes, the 50S subunit of the ribosome of the bacteria, and they are inhibiting the protein synthesis. First, we will see about erythromycin. So, erythromycin is used for adults as well as children, and it is good against gram positive and gram negative. And the most important point for this drugs, this erythromycin, is it can be used for those people who are sensitive to penicillin. So people who develop hypersensitive reactions against penicillin, for such people this drug can be used as a substitute, and it can be used for upper respiratory tract infections such as tonsillitis, pharyngitis, mastoiditis, etc. Adverse reactions are nausea, epigastric pain, diarrhea might occur occasionally, skin rashes, fever, candidiasis, thrombophlebitis, etc. can be seen. Thrombophlebitis, you might know it is a formation of blood clot in the veins. It usually occurs in the legs. Next is azithromycin. Azithromycin is chemically different from erythromycin. Now, this is also used for lower respiratory tract infections, okay, pneumonia, COPD, chronic obstructive pulmonary disease, and bronchitis. Apart from that, ear, nose, throat infections such as tonsillitis, sinusitis, otitis media, pharyngitis can be treated. Adverse effects are vomiting, dyspepsia, what do you say, flatulence, that is gas formation, jaundice, palpitations can be seen. Some allergic reactions can be seen, such as rashes, photosensitivity, that some people might develop sun allergy. The immune system of such people will be activated when they come under the sunlight. So in sunlight they develop some itchiness or eruptions, redness, etc. on the skin. Next is the clarithromycin. Clarithromycin is 2 to 10 times more potent than erythromycin. Now this clarithromycin is used for treatment of both upper respiratory tract infections and lower respiratory tract infection. So erythromycin was used for the treatment of upper respiratory tract. Azithromycin is used for the treatment of lower respiratory tract, but clarithromycin is used for the treatment of both upper as well as lower respiratory tract infections. And adverse effects seen are the minor adverse effects are nausea, diarrhea, abdominal pain, etc. Other side effects are headache, skin rashes, and some elevation of enzymes in the liver and hepatic dysfunction can be seen. So these are the three important macrolide antibiotics. So as soon as you see the name macrolide antibiotics, it should come to your mind that these antibiotics are used for respiratory tract infections. You have erythromycin, azithromycin, and clarithromycin. So this is about the two categories of antibiotic drugs, the beta-lactam antibiotics and the macrolide antibiotics.